Moorfield Health Centre, can I help?
And I was leaning on my goalpost and I said to my dad that I feel dizzy. And the last thing I remember him saying to me was, sit down, just collapse.
In prison, you were essentially bullied. So what's that from?
Burns.
Really?
Yeah.
With cigarette butts?
Yeah.
He's really crying in pain and he just can't open it and he's rubbing it.
Can you see through that eye?
I've had 3 burst eardrums in 2 weeks.
I was in chronic pain. I mean, it was definitely at least a 9 out of 10. I couldn't speak because I was in so much pain, but I knew that there's something wrong.
Health Centre can help you. Good morning.
Oh, your lace is undone. Oh, dear. Thank you. Go and sit by Mummy then, Billy. Come sit with Mama. Come here, sweetheart. Good boy. Well done. On Mummy's lap, please. I know, sweetheart. All right.
Is he not happy?
No. Basically, he gets impetigo quite a lot. This time round, he woke up screaming and like going, it hurts, it hurts. But I think it's where? I think it's up his nose. He's picking his nose, put it in his mouth, and it's transferring from here to here.
I think what we should do is do a whole lot of swabs to find out if there are viruses there. Because, of course, if there are, I mean, that would explain a number of things. That would explain why he keeps getting it. And it would also tell us a slightly different approach to treating it.
Yeah, this time he's in a lot more pain with it. Then.
Finley, can you leave that alone, please, sweetie? What else can I find you to play with?
What's that? It's OK, look. Say thank you. There you go, don't drop it, because it's quite heavy.
Yeah! Ah, fantastic.
Good boy.
Mummy,
Mummy, see?
I was going to say, children aren't always very good at knowing whether they've got pain or not. They describe something as pain when it isn't.
Yeah.
So, very healthy. He's doing, actually, what children should be doing, exploring. We just have to make sure he doesn't break anything.
Yeah, because he will jump down from there.
Well, that's all right.
Come here, sweetheart, listen. Oh, you're going to go for a sleep, are you? No, then.
There's a...
Look, you're making a mess.
And we'll also take a swab from his nose to see if he's got stuff in his nose.
Yeah.
Because that might be relevant.
Yeah, and he doesn't stop picking it.
No.
Stop picking.
I don't... I think this is a normal child. I think he's doing all sorts of normal child things.
Are you?
Which include picking his...
Oh, and eating it. That's gross. Sugar baby pie.
Go and get the stuff. I won't be a moment.
Okay. Let me see in your ears. Ready? Finley? Mummy, have a look. He's taking your job, I'm afraid.
Very good, very good. Finley, just put your head
Good
back.
boy, that's it. Good boy. Tickle, tickle.
That's
It's okay, good boy. Well
good.
done. Finners.
The other one, he needs to sit on your lap.
Finley,
this will hurt a little bit, so keep very still.
Okay, it's okay.
Finished.
Well done. Well done. Good boy. High five. You did brilliantly. You did great. There.
Who's the doctor?
Dr. Cordell. Yeah.
Hello. Just hold it for 10 seconds. So yes, when the results come back, give him a ring and see what he wants to do about it.
All right, okay.
All right. Bye-bye. Yeah, OK.
Hazel Sarrow, please. Have a seat.
Right, thank you. Okay. Oh, nice and cool in here. Oh, no.
The windows are open, I know. Yeah.
It's like me, I got my whole house open.
Right, what can I do for you?
I have 2 fingers that keep locking up.
OK.
Which I thought would go, but my little finger is now following that finger.
Right, so it's your two, so your little finger and your ring finger.
Yeah.
And how long has that been for?
It's been, I'd say, for about a good 5-6 weeks. But I thought, you know, like sometimes you think you've pulled something and it'll go.
Yeah. So they're locking shut. Yeah.
They're like actually down like that,
Yeah.
and to get them to go up with the rest of them, they kind of follow along, but like within a clicking movement.
Yeah. And how painful is that then?
It doesn't hurt.
Doesn't hurt.
It's just weird.
Okay.
It probably follows along with the rest of me.
So, okay, let's have a little look at your fingers. So, at rest, doing nothing, not painful?
No.
Looks okay.
I've not noticed any swelling
No
or...
swelling?
Yeah.
No. So there's no funny nodules or anything?
Not that I noticed.
No. Good.
In my pudgy hands.
They're not pudgy. Okay, I mean, it sounds like sort of trigger finger.
Oh, don't tempt me. I've got a lot of people I could shoot at.
Let's have a look. Right, so, yep, that makes a good diagnosis, isn't it? A trigger finger is a finger that becomes locked after it has been bent, flexed. That's exactly what it is, isn't it?
Yeah.
And 1 in 5 people will improve without any treatment.
There you go then.
Okay.
Yeah.
Now, if it's not bothering you, I think that's our biggest option, isn't it? Sometimes then, if it's not helping, you can use a splint, a steroid injection into the tendon sheath.
That sounds lovely.
Yeah, it doesn't, does it really? So let's do the nothing.
Yeah, I
Fine.
didn't expect there to be a quick and easy answer. Yeah.
There we go. This is about your fingers.
Your wonky fingers.
Yeah.
Yeah, lovely job.
Nice
Thank you
to
very
see you.
much. Thanks,
Bye-bye.
lovely. Bye.
Come on in, have a seat.
You right there, love, yeah?
Yep. OK, so I've got a letter from the probation service.
Well, I got released, obviously, yesterday from Guy's Marsh prison.
OK, yep.
So they would, obviously, what it was, I wanted to get things in motion. I wanted to plan things to make sure, because last time I got out of jail, I ended up getting back on it. So this time I put a few things in place to make sure everything was right. I ain't gonna lie to you, my chest is bonged up, you know, and I started smoking again, like
Right.
a bit of twat, really.
So you're
but-
allowed to smoke in jail again?
No, you're not allowed to.
As soon as you came out?
Yeah,
Right.
you know what I mean? And where I'm not used to it, it's
Okay.
killing my chest off.
That's fine.
This is what I wanted to show you.
Oh, yeah.
See?
OK. So what's that from?
Burns
From what?
from being picked on in jail.
Really?
Yeah.
With cigarette butts or...?
Yeah.
Right. Oh, dear. I think they're infected.
Yeah, that's
OK?
what I thought.
So we'll try a course of antibiotic for that, OK? So that's another thing. Yep. So there's quite a few things. Take a seat again.
I need to also see something about my mental health.
Yeah.
My head seems to be going on me. 1 minute I'm all right, next minute I'm stressed out. I actually feel like suicidal.
So they said there's a few things. Should we make a list to start with?
Refer to a list because,
Come on in, hi.
I've wrote a bit of a list.
All right.
Sometimes people need more than their 5 minutes.
It's 10 minutes, isn't it?
10 minutes, whatever it is.
What else have you got on your list?
It's about 1, 2, 3, 4, 5, 6. See, my memory is very...
I know the feeling. Look at me. I've got lists everywhere.
What I will probably do today is concentrate on the acute thing, if that's OK. Otherwise, I'll be in big trouble, even bigger trouble in the waiting room.
There's 1, 2, 3, 4, 5, 6, 7 things that I'm going to try and do in 10 minutes, which is going to be quite tough, all right? So I think we get the things that we've got to get done today.
Important things, yeah.
And then we'll
that's
move
fine.
on, OK? Is the probation officer that you've got helping you
it's
with
the same-
things like housing and...
Yeah.
Yes.
Also asked her to try and get me out, because obviously I was doing a bit of reading in there. I was getting
Yeah.
pretty good at it as well, so I want to continue that.
OK. And at the moment, you are not taking any opiates, any
No.
heroin or
No.
substitutes. OK, so that's that form done. OK. And your certificate will have drug addiction therapy as the reason why you're not working, yes?
Yeah.
Right, and have you used at all since you've been
No, I
out?
ain't used nothing.
So I'm going to do the scripts now for 16 milligrams of the Subutex on a blue script. Yep. So in prison, you were essentially bullied. Yeah.
Pretty much.
Did and you didn't feel safe?
Nah, I felt safe, but just, yeah, I wouldn't say bullied. I wouldn't go that far.
Wouldn't you? Well, those attacks on your body.
Yeah. Childish, innit?
Yes, exactly. Yeah.
Yeah, believe it or not, there's a lot to take in when you're this side of the wall. Believe it or not.
It's very different.
Still soaking it in at the moment. Yeah. It's a lot more stressful out here than it is in there.
OK, so let's do your chest next. So you've got asthma.
No, I ain't had it for years. Well, I have, but it comes and goes sort of thing.
Yeah.
Because I just got out from non-smoking.
Yeah.
To getting a little bit carried away, if you know what I mean.
Do you think you'll be able to do anything about smoking?
Well, give that, you mean?
Yeah.
Oh, I don't know about that.
So let's have a listen in and check you haven't got an infection or something. That's clear at the front. You're a little bit wheezy at the back. Definitely. So you didn't have any problems whilst you were in prison?
No.
I'm just thinking that if I give you some inhalers, I'm not sure how useful they're going to be if you're smoking quite a lot. You know what I mean?
You just cut down.
Yeah.
Well aware of that.
Yeah. Do you want to just try that for the next 10 days, and then when you see Dr. Clark, you can review it again?
Yeah.
So for skin things, we normally give flucloxacillin 4 times a day for 5 days. Yeah?
Yeah, that's fine.
So that's another script for you to take round. OK, so how are we doing? So we've done the amitriptyline, we've done the Subutex, we've done the form for Rhodes, we've listened to your chest, we've done a certificate, we've done the skin. So the only thing we haven't done, which I think really needs a bit longer than we've got, is to think again about how your mood is.
Well, you're on a deadline, aren't you?
Well, we get 10 minutes for each patient.
Oh, right.
Yeah? That's what we're booked. And it's difficult to manage this many problems in 10 minutes,
Yeah,
but
of course.
I'm giving you a bit more time and not helping the others out with the other patients
Yeah,
at the moment.
I appreciate it.
Is that
It's
all
just
right?
like, if I don't cover all the angles,
Yeah.
you know what I mean, it gets
Yes.
too much for me
Yeah.
to deal with.
So what I want to do is get you an appointment to see Dr. Clark before this script runs out, and you really must attend it.
Yeah, don't
okay?
worry, I will be.
And what I'll do is I'll give you 20 minutes with her.
Everything, yeah?
That is everything apart from reviewing your mood, which I think needs more time.
Yeah, definitely.
Yeah? OK, George.
Definitely. Appreciate that. Thank you.
That's OK.
You have a nice day.
Bye now.
Bye.
What's your date of birth?
8240. Hello, you're not here as well, eh? Oh, my door. Everybody's falling apart.
Hi.
Hiya.
How are you doing?
I've had a really funny tummy
right.
since last Monday. And really painful. And I thought, OK. And then after that, I sort of felt a bit dizzy, fevery. So I went to bed early, but the next day the diarrhoea came, and that wasn't very pleasant. And that's been going on since really.
So
and,
basically into the... It's been exactly a week now, then?
Every time I ate something, you know, 5-10 minutes later, I was in the loo. The worrying thing last night was I sort of woke up and just had a glass of water at about 3. Got the griping pains, but also these awful pains down my leg again.
All right. You said that things seem to have settled a little bit over the day-to-day. Is that compared with all week, or is that just compared with last night?
Compared with all week, really.
And no blood anywhere?
No, thank goodness.
Are you working at the moment?
I work in a primary school.
OK. What do you do there?
I'm a teaching assistant, but you can't rush off and go to the loo for 10 minutes in
well,
the school,
also,
can
if
you?
it is a bug, which it does sound very likely, you wouldn't want to be spreading it around the school too. So, 162.99, which is a little bit high. Sometimes, if you're a bit unwell, it can push it up, and you know, sometimes just coming to the doctor can make it high. So I'm not going to get too worried about a single high blood pressure reading when you're not very well. You said nobody else has been unwell. Have you eaten anything funny?
No, the only thing I could think of, you know those baguettes you can get, those part-baked things? I'd done those on the Sunday, but everybody had eaten a bit of that. But the following day I had a bit with some cheese, and my husband picked them up later, and you know how sometimes the bread bag can smell of acetone? He said to me, these... I thought, oh, no, I've eaten a bit of those. That's the only thing that was different to anybody
But as you say, everybody else had them, so it'd be unusual.
Them, you know, on the Sunday.
Hop up on the couch. Let me have a feel of your tummy.
OK.
There you go. Rest yourself back. Can I just have a look
Yes,
here?
of course. Probably a bit warm.
It's all right. How many times a day are you going when you get the diarrhoea?
Sort of like every couple of hours, but I'm not wanting to eat much, so...
No.
But it's always after I've eaten something, about 20 minutes or so.
Yeah. Any pains in the legs there?
Nothing.
No.
Just the pressing pain. That you're
Sure. Well, jump up and come and have a seat. It is likely that this is just a tummy bug. Where you've got it from is sometimes difficult for us to say. And it's true that you wouldn't usually expect to get leg pains as one of the things that you get with classic tummy bugs.
That's right.
Sometimes you might get some leg pains if you've got a temperature or an illness, and it can make you have aches and pains all over in the muscles. Right. Or it may be that you've just lost some of the minerals in the diarrhoea, and that's got you a little bit deficient in some of those that might give you some cramping. So there are a couple of explanations that I'd be happy with. But I think the main thing is, actually, they seem to have settled down and the diarrhoea seems to be settling, and actually your tummy is soft and there's no tenderness there now. So I'm not going to overreact. I do think you need a few more days off until it's all definitely gone away. And it's definitely true that I would like to see a poo sample, because it has been going on a week, just to make sure that there's no infection there that we should be treating.
OK. So do I get that from the treatment room?
From the treatment room. Sorry, I've run out of them from here, so you'll have to go and collect
Thank you. Nice to see you.
Nice to see you, and I hope it settles down in the next few days.
And me. Thank you so much.
Bye then.
Bye-bye.
$11:30, 12 o'clock, 12:30, 1 o'clock, 1:30, or 2 o'clock. Or I got Monday evening.
Right, what do we need to discuss?
You've had pains in your ankle, haven't you, for a while?
Pains in the...
In her ankle, and then it's all swollen up. She's been down twice before because it's swollen. They gave her antibiotics, but it hasn't gone down. She'd come back again because her leg was swollen, like the top of her leg was swollen.
3 inches bigger than this.
But the last couple of days, she's suddenly been getting pains in her head, like headache pains, and saying that her face and things ache.
And now here hurts, and in the car, my jaws started hurting, and it's inside.
But she's got a hospital appointment to come for Tuesday, but I didn't want to leave it sort of the weekend.
Do you mind if you just have a look and see what the last doctor wrote about you? You had a sore wrist as well, is that right?
Yeah.
You still got a sore wrist?
Yeah, it hurts when I do that.
She wondered whether you might have what's called an inflammatory arthritis, which is something that can be triggered off by infections in children. Felicity's case is not clear-cut, but she had several features such as swelling and tenderness of joints, which suggested inflammatory arthritis. There are several different types of inflammatory arthritis, and it can affect all age groups, including children, very often triggered by an infection. So the first things you saw were these spots?
Yeah.
And are they starting to improve?
Yeah.
OK, so whereabouts in your head and your jaw is it hurting at the moment?
Here and up here.
OK, do you think her face is swollen at all, Mum?
Yeah, my mum said this morning about her face looked a bit swollen.
So is that pressed around here? Is that sore at all?
No.
Particularly over there? No? Press around here, is it sore at all?
No.
No. Cut for me? It's pretty normal. Whereabouts in your head is it uncomfortable?
Like, it hurts just like when there's any loud noises, especially when there's loud noises, it makes all over my head hurt.
OK, is it hurting at the moment, your head?
No.
No. So I can't find a specific cause for this headache, which I can put my finger on.
Yeah.
OK, what we've got is lots of little things, and I suspect they are going to add up to something, but I'm not sure what that something is yet.
Yeah. OK.
I think you're probably going to have to wait till next week when we see the kids' clinic and probably have some blood tests done and see what they make of it. OK?
Yeah, that's fine.
OK. Well, I think you've been very brave and very grown up with all this, and you'll have an exciting trip to hospital next week to see what they make of it all.
Get the day off of school, don't you?
All right. So you happy with that?
Yeah, OK, so, all right, thank you.
Okay.
All right.
Thanks, bye. All right.
Yeah.
You're coming because I phoned you last night, didn't I? Yeah. That's great. Thanks for coming. And don't be alarmed. The reason you look worried.
Oh, yeah. Well, I am a little bit worried. Also, I'm not very well. Yeah.
Okay. Shall I start with why I phoned you? So you had your smear taken, and because on that we had described you as having bleeding after sex, the report came back saying the smear results were absolutely fine and normal.
Oh, right, OK.
But this bleeding is going on.
That's what I want to talk about.
OK.
Right, so I'm on my period now. It's the first period I've had for 3 months.
OK.
Yesterday, I was in chronic pain, and when I say chronic pain, it was definitely at least a 9 out of 10.
OK.
I couldn't speak because I was in so much pain.
OK.
It was unbearable, just like... I'm really feeling sick with it every time as well, like I'm going to throw up. I'm getting really, really painful periods anyway.
Okay.
I'm getting pain after sex. I'm sometimes bleeding after sex.
Yeah.
So all these things are happening.
Can I just ask a couple of other questions, just to clarify in my head? Are you on any contraception of any sort? No. OK. Are you trying to get pregnant?
No, we're not trying.
So,
I'm going perimenopausal for the last 2 or 3 years anyway, with hot flushes and all the rest of it, and then my periods are becoming more scant.
Yeah.
And when the pain happens, it feels like it's in my bowel. And each time it's been really severe, it's been that same sensation.
OK.
It's completely abnormal.
Yes.
You know, I want thorough investigations done.
Agreed.
Because they've done these, you know, the ultrasound and everything, and I could feel it in my bowels.
Yeah.
The pain is so severe that I knew that there's something wrong.
In my drawer, you'll find a pack of like rice cakes.
And plenty of fruit and veg.
Always eat pears every day.
Sometimes I'll literally eat like a salad and I look like I'm pregnant.
Yeah. Because I stopped drinking cold water, and it's been more than a year now. I just drink warm water.
Made any difference? No.
And what about meat? Do you eat much meat?
On a Sunday, I have my cooked dinner, but probably in the week it might be ham.
I've practically given up cheese.
That's a shame.
I know. Every now and then I have a little binge out.
Yori McRae. So if you come round and have a seat, and your mum, yes?
Maxine, yeah.
Maxine. So I'm Dr. Graham. How can I help?
Yori has been doing a regular checkup on his health about overweight.
Yes.
He went to see the consultant in children's.
Yes.
And I received a letter that he needs to sign up on the program for Slimming World.
Right.
Where he, I think they sent a letter about him getting some vouchers.
Yes. And he's still being seen by the clinic at the hospital?
Yes, he have an appointment coming up in November.
OK, so the plan is that he goes to Slimming World or Weight Watchers before then?
Yes.
And then they see how that goes?
Oh, yes, because he's overweight for his age.
Yeah. OK, that's great. So we need to fill in the form for the Slimming World and Weight Watchers scheme. Let me explain to Fiona how that works, OK?
OK.
So if you go into there, OK, so it's Live Well Bristol is the organisation that's running this service. So what we do is we fill in the form and you sign to say that you give permission to be run by this organisation. And then they ring you and they tell you which services are available near to where you live. This is usually for grown-ups. You are quite grown-up, so I think it's reasonable to go to a grown-up one. How do you feel about that? You're all right with that? I think that's what's important, to be honest. Is it something you want to do? Because you need to do it, don't you? You need to want to do it yourself, yeah? Do you see what I mean?
Yeah.
And you'd be going too?
Maybe.
No, accompanying him.
Yeah.
Is what I meant, really. Yeah. So I will put that through.
Yeah.
But I want to tell you what the children option is.
Yeah.
Yeah. So the children's option is something called Alive and Kicking.
He has been through that several times and it doesn't...
Fine. That's helpful. I'll put that down here. This is about re-educating normal eating patterns. Are you feeling reasonably positive about it? Yeah? Good.
Okay. So do I take this or I leave this with you?
No, we process that.
Oh, you process it and take it?
Yeah.
Okay. Thank you very much.
That's all right. Okay.
Thanks a lot,
Bye
Dr.
now.
Graham. Bye.
I agree, it's time for us to ask gynecology to see you.
Yeah, definitely.
It is worth just checking your ovarian hormones to see where you are in relation to menopause. So if we'll arrange for a blood test, I'll request a scan, I'll write a letter to gynecology asking them to see you.
Okay. So there'll be specialists in Andrew.
They'll be specialists in that, gynecologists deal with everything.
With all of that.
All women's health, kind of.
Okay. Brilliant.
Can I put a hand on your tummy? But I don't think I need to do an internal examination in that you've had all these scans that are doing that.
So you just need to
Just want to, yeah, if I can just get you to come and lie yourself on here. And you're still feeling pretty
tender.
Yeah. Yes, you look like you're kind of moving gingerly. I'll start on the right side just so. Even that's a bit sore. Yeah.
It's
Okay.
really tender, actually.
And that is sore over there if I press a little bit harder.
Yeah, that hurts.
Yeah. Okay. Fine. Come and sit yourself up again. I'm not going to do any more than that today. And you say that someone has looked at your cervix.
Yeah, they
just want to make sure that
they
that's...
put a camera inside me when they did the ultrasound as well. They did an internal.
But that's an internal scan rather than having...
I thought they were checking the cervix as well.
They don't look at it. I want someone to visually...
Okay.
Okay, so leave that with me.
Brilliant.
Just take that to the desk. They'll sort you out the blood test.
Excellent.
Okay. But if you're in trouble, just give us a ring.
Okay.
And I'll get back to you.
All right then. Thank you.
Get you back in. All right.
Bye.
Let's go. Hi.
Hiya.
Let's go. Follow the
You
doctor.
Zachary?
Yeah, he's Zachary.
Yep, come along, Zachary.
Okay, follow the doctor in. Joshua and
Few more
Benji's
chairs for your clan.
Don't worry,
I
no,
think.
they can just sit on the floor.
Mum, come and sit here, and we'll find another chair for you, Zachary.
Zach, can sit on my knee. It's fine.
Okay.
No problem. Come here, Puppet.
All right, an eye problem, obviously.
Yes,
Yeah.
really
Talk me through it.
Just, I mean, he says it was hurting yesterday, but I've only noticed it today. And he just can't open it, and he's rubbing it, and I've tried to have a look, and I can't see anything in it, but I just wanted to... He's really crying in pain. At times, it seems kind of on and off.
Did it come on gradually or suddenly?
Suddenly, I think. Did it come on suddenly? But it's just the opening. He's doing this all afternoon.
Yeah, okay. Can he see through that eye? Obviously, it's uncomfortable for him, but if he opens it...
At times, he's been okay.
Yeah.
And he's... Yeah, you can see through it, can't you? It's difficult to tell whether anything's blurry or anything.
Okay.
So, sorry, that's not very helpful.
Okay. And has he had any discharge from it?
No, nothing at all. It looks very bloodshot, but...
It does look very bloodshot.
I think that might just be the rubbing.
Do you think he's managed to rub anything into it?
Well, I mean, it's not like he's been playing in the mud today or anything.
Okay, look to your right, would you? Okay, now we're going to look in this one. It's interesting, Mum. If you look in this side, even this one's a bit
I know,
bloodshot.
he's not been rubbing that one at all.
No.
That one's been the good one.
All right, now I just want to check that you can see all right. Okay? You're going to have to open your eyes for this. How's your reading, Zach? Are you good at reading?
He's very good at reading.
Yeah? So if I give you something to read, you don't really need to manage the words, you just need to tell me what the letters are. Okay? Let's cover that eye, and you can just tell me what the letters are at the top. All the words, if you want. A P, then what?
Le.
Fantastic. And now let's try it with this eye. Open it up. Fantastic. So your reading's all right. My guess is he's actually got a viral conjunctivitis. That's what it looks like. So quite watery, uncomfortable, red both sides. Bit worse on the right, and he's compounded it by rubbing, and maybe he's scratched the surface or something like that. And I suggest what we do is give some soothing drops overnight. Okay. These are technically antibiotic drops. The point of using them is that if he has scratched the surface, then they will just help it.
Stop. Okay, great, thank you very much.
All right.
Okay, I'm going to get some nice drops in.
You were terribly good today, actually. Fantastic.
You were really
good work.
brave. Good job. A little bit of medicine in your eye is going to help it feel better. Okay?
Okay, well done. Well done.
Okay, are you okay? If you walk, I'm going to take the prescription. Thank you very much.
Do try not to rub them, okay? Because when you rub a bad eye, it sometimes makes it worse.
So viral conjunctivitis isn't going to be infectious, is it? Or is it?
Be.
Everything else. We'll keep wash hands, okay. Great.
I'm going to wash mine.
Okay, good. Yeah. Okay, out the door, say thank you very much. And
well done,
bye-bye.
guys. Bye-bye.
Bye-bye. Thank you.
Okay,
Thanks a lot.
bye-bye.
Which way do we go?
You go left.
Oh, left. Perfect. Right.
It came in from my stomach because I did another poo sample last week.
I saw that.
Yeah.
Yes.
And that's come back the same.
Yes.
I'm still getting the same problems. I'm doing the FOD diet now.
Okay.
And
how's that?
It's going okay. So I'm trying to stick to it as best I can. I'm still getting the very loose diarrhea in the mornings and the cramp. But it's when I'm in the toilet and I'm having this, like, I go so hot and clammy and sweaty.
Right.
Like, I need to have the door open.
And how often does this happen?
It's every morning. It's in the morning as well, it happens.
Is it always once a day, or is it more often?
Well, I only do it once a day.
It's once a day?
Yeah.
It's once a day, and then...
I
and
have
it's always
very
in the
bad
morning.
bottom wind all day.
Oh dear, right.
Constantly. And it's quite, I mean, it can be quite embarrassing because it is quite bad.
Yeah. And when did you start this FODMAP diet?
About a month ago now.
And are you managing to stick to it? Because I know it's not that easy, is it?
No, I am. Yeah. Apart from pork pies, I kind of got a thing for pork pies. I'm trying to cut back on them.
Okay.
So, because I think they're probably... And also, Coke, cans of Coke, I've cut down a lot on that because I know that's not good either.
That's not good, no.
No,
really
and...
good. And how much Coke do you have a day?
Probably about 1 to 2 cans now.
And what were you having?
Probably about 4 or 5 cans. So yeah, it's not.
Is that Diet Coke or is that ordinary?
Ordinary.
Ordinary Coke.
Yeah. So,
okay.
Which I know is.
I think that's probably quite a lot of the problem. Isn't
Yeah.
It? Yeah. Because I mean,
So-
fizzy drinks are really bad. For
Really
you.
bad.
Really
yeah.
bad for you, and all that sugar content as well.
Yeah.
Let me just look at the tests for your
Yeah.
bowels. Okay, and we've done all the blood tests, haven't we, to rule
Yeah.
out anything serious?
Yeah.
And celiac screen and everything. You know, we have investigated this one, and I think almost certainly this is diet related.
Yeah.
I think it's really the pork pies and the Coke, isn't it?
Yeah.
I know it's not easy when you
No.
really like them, is it?
No, but it's going to help my stomach. Then.
I think so. I think so. I think if you can do that, it will gradually get better.
Yeah, definitely. Yeah.
Okay.
All right.
All right.
Thank you.
Okay. Bye.
All right, bye.
Take a seat, Craig. So thanks for coming in. So I just wanted to check your height and weight and see how you're getting on with your tablets. So how are you getting on?
They're getting on all right, to be fair.
Mm-hmm.
They're improving with the sleep.
Mm-hmm.
Because I think it's getting easier for me to cope with them.
OK. What do you mean easier to cope with them? What was
Because I know roughly when they're going to wear out if I take it at a certain time.
Uh-huh.
So I take it now as soon as I wake up.
OK.
And then it wears out usually around about when I go to bed.
OK. So, and do you feel a lot calmer on them?
Most days, yeah.
OK. Craig is taking methylphenidate, which is one of the treatment options for ADHD, or attention deficit hyperactivity disorder. Another name that methylphenidate is commonly known by is Ritalin. Craig was diagnosed with ADHD in early childhood, and initial therapy is started by a specialist in this area. And we have a shared care program by which we also monitor the methylphenidate. We have to monitor growth in children, and that's why I was checking his height and weight. It can also lead to an increase in blood pressure, which is why we keep an eye on blood pressure. You last had some kind of seizure, or...
Yeah.
That was about a year ago. And he went to A&E. He'd never had one before.
No.
What was that all about?
I was outside in my garden playing with my little brother, and he went in for 5 minutes to get a drink and go to the toilet. And I was leaning on my goalpost, and I said to my dad that I feel dizzy. And the last thing I remember him saying to me was, sit down. And he described it to me as that I literally just collapsed.
And you've not had any problems since that? So for
No.
a year, you haven't had any of this query seizure, we should call it, really?
But I have been getting dizziness since then.
Has that been long-term since then?
Happened about 3 times a week since it happened.
I'm not particularly itchy.
No, unless like I go, is it itchy? And then I sort of have the notion in my head.
These kind of bits are itchy.
Does it feel itchy?
Yeah.
Are they itchy? Making them itch with your eyes.
Oh, good, a bit itchy.
OK, how can I help?
I had some bloods done last Friday.
OK.
Just because I've had some symptoms of a urine infection.
There was some mention of an infection around the feeding tube. Is that the other thing?
Yep. The other day it got pulled by accident and it's just been a bit weepy and...
Let's have a quick look. What's the best way of looking?
Lift the dress up, I guess.
Yeah. Is that all right?
Yeah, no, that's fine. Yeah.
Okay, great.
It's not taped the best, but yeah, it just got a bit yanked the other day. I've been cleaning it.
Natalie has a feeding tube because her stomach doesn't empty properly. So she has a tube put in beyond her stomach in the small bowel. A bit weepy, and it's a little bit red.
Yeah.
A bit inflamed. Yeah.
Yeah, and it's not usually like that.
So, and the fusidic acid normally does the trick, does it?
Yeah, it usually does.
I think because it's weepy, it's worth giving you some of that, OK? And then if it's only inflamed, sometimes we just give some steroid cream for it. So hopefully that'll clear it up.
Sorry, thank you for...
That's that.
Do you know that? I always feel awful.
That's all right. Let's go to the blood test. So the kidney function is entirely normal.
Wonderful.
The liver function is pretty much normal. So your ALT, which is one of your liver enzymes, is slightly raised, but actually less raised than it has been.
Yeah.
And then you thought you might have a urine infection?
I thought I might do. I dipped it at home because I've got the dipsticks, and it came up with negative anything at the time, just because I've had urosepsis a lot.
Yeah.
Just overly cautious, and yeah, I've had to self-catheterise a few times on and off.
If you had nothing in the dip and your bloods have been all right, you probably haven't got an infection. Natalie has a history of regular urine infections, which are a common complication when people self-catheterise, and sometimes those infections can be quite serious and not only in the bladder and can cause her to have bacteria in her blood, which is a much more serious condition. There's quite a lot of evidence that quite a lot of people with symptoms that suggest a urine infection will get better without any treatment, and quite a lot of urine infections are inflammation rather than infection.
I'm constantly inflamed everywhere at the moment, so I did wonder if it could just be
part of that. Yeah, OK.
Is there anything that I can do to help when I'm having the allergic reactions? I'm taking IM Piriton, cetirizine down my tube, prednisolone. I've got steroid creams, but I just can't stop scratching.
You're on quite a lot for
of
it
things, yeah.
already, so I'm not sure that I've got any miraculous ideas. Sorry.
Smothering myself in Dermacol every night.
She stops you from scratching.
She does, yeah.
The reason why you want to scratch is because histamine's been released. But when you scratch, you release more histamine.
Yeah.
So trying to not do it, but it's kind of easier said than done, isn't it?
Yeah.
Okay.
Yeah.
All right.
Thank you very much. Thank you so much for your help.
That's all right.
I feel like I need to breathe in.
Okay.
Thank you very
Nice
much.
to meet you.
Nice to
Bye.
meet you too. Thank you.
We should see you every year while you're on these tablets because we've got to keep an eye on blood pressure and height and weight. It may be worth you just booking in for a routine blood test. Just want to check a few things out with regards to the tablet, and also because you mentioned feeling giddy 3 times a week. And does that have any effect on you? How long does it last when that happens?
It's usually about a minute to about a minute and a half.
And what's happening? Is the room spinning?
I just can't see nothing and I just wobbles.
OK. Do you get a headache with that?
Yeah.
OK. Is there any migraines in your family?
No, but I have had migraines in the past before my seizure.
OK, so we'll keep an eye on that and get your blood tests done. If that gets any worse or changes, to let me know.
All right, yeah.
OK.
All right.
All right, Craig.
Thank you.
Take care.
Bye.
Brian Tunnicliffe. Come and have a seat.
Thanks.
Okay, so are we talking about your ear today?
Yeah, my left ear, I've either got an ear infection or a burst eardrum. I normally suffer with them quite a lot because my hearing obviously ain't too good.
Okay. What symptoms have you noticed?
Well, gunk coming out my ear, and plus I've got a bit of a cold, so painful in my ears.
It's been painful as well, has it?
Yeah.
Yeah. Is it painful now that there's stuff coming out of it, or was it painful
Not as
before?
much.
Not as much, OK. So was it painful and then started to discharge?
Yeah.
Yeah, OK, fine. And so have you burst an eardrum before from the sound of it?
Yeah, I've had 3 burst eardrums in 2 weeks before.
Right,
So,
OK, gosh,
yeah.
so it's happened many times.
Yeah.
Yeah, I can see, I've just had a quick look at your notes before you came in. I was seeing that you've got hearing aids and so forth. And is your hearing not so good at the moment as well?
Not so good at the minute
Yeah.
because obviously, yeah. Plus I've just come back from Benidorm, which the heat might have something to do with that as well.
Were you swimming?
Yeah, quite a lot.
OK, OK. So let's have a look. Just get myself a...
I'm going to have to take out my hearing aid now, but yeah.
So once you've taken it out, can you hear me?
Yeah, because I'm still can hear in my right ear. I'm
Yep.
just deafer in my left ear.
Fine.
But you might need to speak up just a tiny notch.
I will.
Thanks.
It's just... Oh, I can see the muck without even putting my thing in your ear here. I will have a little look, but I'm sure you have... Yeah, you know what's happened.
Yeah.
OK, I can't actually spot where it's coming from. And there's not a lot of stuff in the canal, which is good, but I will give you antibiotics. That's what you need now.
Thank you.
OK. I don't think they'll give you your medication unless you've got someone over...
No, my mum will probably go and collect it, so yeah.
OK, so that's the week's worth of amoxicillin, same as last time, so it's 10 mils 3 times a day.
OK,
All right.
thank you. Thanks for your help.
OK, pleasure. Bye-bye.
Bye-bye.
Bye.
Bye.
Thank you.
OK, then. Thank you very much. Yes, you'll be better off driving.
OK, bye-bye, boys. Say bye.